clinical strategy is a roadmap. Enables us to understand where we are now and where we need to be in a few years' time.
Having a clinical strategy for the whole of Nottinghamshire healthcare across all the services will really help us define how we're going to develop our services over the next few years.
I think it's wonderful for the clinicians on the ground to have an overarching strategy. I think we're such a large trust that sometimes each individual team can feel a bit lost. It's largely a mental health trust. I come from the physical healthcare side. I think they haven't particularly got an identity within the trust. You hear people say, oh, you know, we're forgotten, we're not included. But when something like this comes out, you've suddenly got this overarching strategy which puts the clinician, the clinical work at the centre, so therefore the patient at the centre, which is exactly, of course, what the clinicians want to see.
A good clinical strategy has underpinnings of evidence-based practice, and it will have better outcomes for patients, but also better outcomes for the service.
Well, partnership is essential. We all work in very community-facing services these days. Partnership with GPs is important, mental health services as well. Partnership with geriatricians is particularly important, and we're all moving towards working in an increasingly integrated way with health and social services combined together.
Clinical services can't work alone because they don't have the IT and admin and infrastructure to pull all these things together. So collaboration with primary care services, secondary care services and the voluntary services allows us to achieve the goals and the missions of the trust itself and the services by utilising the skill set from different areas.
Developing a partnership and collaborating with third sector organisations has been really important, and that's enabled us to not only win tenders but deliver services in a very new and exciting way.
I think we're quite good at looking at the holistic needs of the child, and alongside that, of course, you get quite good at partnership working, because as a standalone health professional you can achieve nothing. The child is in a family, in a community, in a school, goes to respite, goes to grannies. You know, we're not going to achieve anything without bringing everybody on board.
So I think in terms of patient involvement, it's critical. For me, in CAM services, we are conscious that our service users aren't just the young people but also their families as well. So we've gone to great efforts to involve families in our clinical strategies in the past. So I think involvement is something that we need to do in diverse ways to ensure that we capture the experiences of a broad range of people. But patient experience is really, really critical in being one of the key measures of clinical outcomes for me.
The voice of the clinicians has to be a lot stronger because they meet patients on a day-to-day basis. One of the advantages that some of us have as clinicians and managers as well is that we regularly interact with patients. We hear what their concerns are. We hear how challenges affect them, and that is very powerful in helping us develop an effective clinical strategy.
So we are looking at quality innovations in terms of reducing the number of untoward incidents on the ward and on our unit, but also looking at having more collaborative approach with patients and the team and also their families, so that patients are better able to manage difficulties rather than resorting to violence or crime. So I think it is quite important to have good outcomes for everyone.
The clinical strategy will allow this new approach. It's a change of focus really from passive treatments to trying to empower our patients to make a change in their lifestyle and take responsibility for their general health.
So the outcomes for service users would be to be as recovery focused as possible, to instill hope, to prevent where prevention's possible, to get the best outcome and the best recovery possible through using our knowledge of the research and our knowledge of what works best to deliver the best interventions that we can.